Well, I see that it's 12 o'clock, so we will go ahead and get started with today's webinar. I want to thank you for joining us as we kick off our Keys to Living and Aging Well webinar series. I'm Grace Smith, Executive Director of AgeWell Middle Tennessee. And on behalf of our team, I want to welcome you to today's webinar focused on keys for physical health. Before I introduce our speakers, I want to thank our series sponsor, GNRC, Area Agency on Aging and Disability, and also our partner nonprofits, Jewish Family Service and the YMCA of Middle Tennessee. We're excited to work together to bring you this webinar series, which will include evidence-based information and tips we can all use to live and age well. Now I'd like to introduce our speakers for today in the order they will present. Our first speaker is Dr. Jim Powers, who is a professor of medicine and geriatrician at Vanderbilt University Medical Center and the VA. Dr. Powers is also on the board of AgeWell Middle Tennessee and chairs our legislative and advocacy committee. After Dr. Powers, Stephanie McClure will be speaking. Dr. McClure is a professor of internal and geriatric medicine and associate dean for faculty and academic affairs at the Thomas F. Frist Jr. College of Medicine at Belmont University. Following Dr. McClure, we'll hear from Elizabeth Hughes Bowles, who is the Director of Healthy Living at the YMCA of Middle Tennessee. And then we'll hear from Audrey Hall, who is a retired nurse and a longtime volunteer with AgeWell Middle Tennessee. And we're delighted to have each of you as our panelists today. Dr. Powers?
Thank you for the opportunity to be with you today and to help celebrate Older Americans Month, the month of May. We'll start with the next slide. You know, it's a wonderful time to be alive in the world today. This is a diagram of the population from approximately 1950. And you can see that as individuals get older, there are fewer of them. This is called the population pyramid. Next slide. Well, here's where we are today. Never before in human history have we had so many older individuals living out their maximum lifespan. In fact, it turns out that by 2030 in the United States, we will have over 1 million centenarians. Never before in the history of mankind and womankind have we had so many older individuals. So it's an exciting time to be older, to take care of older folks, to advocate for them. And we hope that some of this passion will rub off on you and also perhaps some recommendations for good, healthy habits throughout the lifespan. Next slide. Okay, so if we're going to live longer, can we do that in good health? Well, that's the big question. According to the Tennessee Department of Health, Tennessee has 4 big issues to work on for everybody, but especially for elderly. Obesity, it's out there. About half of our population, close to 60%, is overweight. Tobacco, we're in the tobacco belt. We still smoke in excess and use tobacco products much more than the national average. Physical inactivity goes along with number 1, obesity, and certainly takes its toll, as you will see from the rest of my presentation and that of my colleagues. And yes, substance abuse as well. You know, we're dealing with the boomers now. Alcoholism across the board is about 2 to 4% of our older population, meaning drinking to excess and having significant life events, complications related to that. And you might say, well, what about illicit drug use? Well, it's about 2% as well. However, If you ask among boomers, have you ever used an illicit drug? It's an amazing 47% of individuals have used an illicit drug. That translates currently to about 400,000 individuals using narcotics daily in the United States over the age of 65, and about 40,000 daily using cocaine. So substance use disorder is a big issue out there. I often get asked, well, what's the maximum amount of alcohol can I take and get away with it? What's the minimum number of hours of sleep can I sleep and get away with it and do okay? And what's the minimum amount of exercise I can do each day? Well, I'll address those individually. First of all, there is no amount of alcohol that is considered appropriate. In other words, that we recommend that a person takes. In other words, to drink alcohol for any purported health benefits is not recommended by any medical society. In truth, about one equivalent drink per day for women up to age 65 and 2 drinks per day for men is permitted, and you're not considered overdoing it. But as you get older, your metabolism changes, and the effects of alcohol on other medications may be a complication. So generally, we recommend cutting that amount in half. But again, that's permitted, not necessarily for good health, but because people we know enjoy drinking alcohol. Minimum exercise, probably 20 minutes a day, or at least 5 days a week. More if you can do it, the more the better. And minimum hours of sleep, about 7. It turns out we're less efficient as we get older in terms of sleep. And the slow wave sleep, which is the most helpful in terms of restful times, also preserving brain function, helping to minimize the chance of Alzheimer's disease occurs early. So going to bed earlier is much recommended. Many preventive measures are also underutilized. And we've had a lot of discussion about vaccine hesitancy and immunizations, but also counseling on other health issues such as safety, falls prevention, and incontinence. We work on that daily in terms of educating our new doctors to ask about that, because that's so important in quality of life and longevity for the public. Probably cancer screening tests are a little overused among older adults. And it turns out that as you get older, your remaining lifespan is more important. And some of the time frame for the cancers that we're screening are much longer than remaining time frame of life. So it's important to focus more on quality of life, and those things like falls prevention and safety are much more important. Next slide, please. Successful aging is something that has to be very intentional. As the individual gets older, we know that there are changes that are going to occur. Things occur slower. Our reserve is less, but this is very different for each individual. One group has defined successful aging as 3 elements: avoiding disease and disease-related disability. You'll hear more about that from myself and our colleagues. Second, trying to prevent physical and cognitive decline. You'll also hear more about that. And third, maintaining engagement. Very important in terms of preventing social as well as psychological deterioration. Next slide. It turns out that if you put all of the efforts involved in successful aging, lifestyle changes, it turns out that this is very, very important. 40%, almost half of life expectancy is influenced by the personal choices that we make over the lifespan. You can't just start at age 65. This is something that is ideally done throughout the lifespan. So exercise, prudent diet, paying attention to health issues is very important. Genetics is there, but as you see, our own personal choices, much more potent predictor than even genetics. And social circumstances are very important as well. And it turns out that if the average American who is older adopts an appropriate lifestyle, pays attention to the successful aging strategies that you're going to be hearing about here, you can add another 10 years to your life. That is amazing. But this has stood the test of time. Many analyses of populations over time have said that this is actually very, very true. And we're going to talk a little bit more about resilience, but this involves the ability to adapt to change and recover from stress. I'll say more about that as we go along. Next slide, please. Well, performance can decline with aging. There are many things that actually are very beneficial in terms of aging. For instance, we talk about fluid versus crystallized intelligence if we're talking about cognitive aging. It is true that older individuals have more difficulty with gaining new knowledge and processes and what we call episodic memory. On the other hand, they have developed many successful strategies to deal with conflicts and the experience and general concepts really keep them in a very positive territory. Employers find that older workers help the younger workers because they kind of know the ropes. They know what needs to be done. They're also found to be actually much safer employees, fewer on the job injuries, etc. And it turns out that our colleagues at Johns Hopkins have actually done a similar analysis to what I mentioned in the previous slide about longevity. And it turns out that preventing Alzheimer's disease is actually 40% affected by your lifestyle choices, such as making sure that you are socializing, engaging in personal interaction, making sure that you do exercise that brain, and you pay attention to cardiovascular health. What's good for cardiovascular health is also good for brain health. And yes, it can stave off an estimated 40% of the prevalence of Alzheimer's disease. So it's very, very important that lifestyle, positive lifestyle choices be maintained over the course of the lifespan. Next slide. A bit more about resilience. The AARP has done a number of studies to show that we can actually shape our own aging and look at it as an opportunity for growth and not a path to decline. So that if you look at individuals over age 50 to 79, AARP surveys have shown that many individuals have found aging to be a positive experience, identified as not as bad as they thought it was going to be. That's kind of funny, isn't it? But it turns out if you ask individuals over age 70 to 79 in a recent study, 84% report their health as good. So there's a lot to be said for positive attitude and thinking ahead and planning for your future. Just start exercising, just start eating right, and don't think about it, and just keep doing it for the next 10 years. That's basically what AARP is saying, and I have to agree with them. Next slide. We are becoming an even more multicultural society. So it's important, I think, to look at some of the things that are related to culture as well. This certainly influences our quality of life, how we interpret health recommendations, and basically how we work as professionals with families, with individuals as well. And I'd just like to point out a couple of major concerns that we have. Again, going back to Tennessee's top 4 that we talked about, for our Latino population, diabetes is a big issue. And it's probably related to the diet that they have in the United States. Latinx peoples here in the United States have about 150% the prevalence of diabetes as their family members who have stayed in Mexico, for instance. And it's related to the stress, the diet, lack of exercise that many of them experience, particularly in urban environments here in the United States. African Americans are very prone to hypertension and stroke. Not that others are not, but they particularly are affected by this. So paying attention to diet, blood pressure control, medication is just so important there. Among Caucasians, particularly Eastern Europeans, those from the British Isles, have a high prevalence of heart disease. So knowing that they have had perhaps early deaths in their family, perhaps that they have high cholesterol levels, these are some of the things that you inherit. So paying attention to these things that you really can't change, and focusing on what you can, such as diet and exercise, is very important. And so we try to tailor our recommendations to the individuals in front of us who are asking how to maintain a healthy life, healthy lifestyle, positive experience as they age based on their cultural beliefs and needs. And next slide, please.
Thank you, Jim. Greetings, everyone, and thank you, Grace, for inviting us today to share our thoughts regarding the keys to living and aging well. First, I would like to talk about something that Dr. Powers had mentioned earlier. That was regarding many preventative measures are underutilized, and that cancer screening tests are overutilized among older adults. Now, I have found that in some populations, preventative measures are indeed not pursued. However, in minority communities, cancer screening tests are also underutilized rather than overutilized. And what is the reason for that? Well, if you ask some folks that I know, they were never asked by their provider to get a screening test. Or if they were asked, they simply said they did not want to do it, and the provider did not share informative information as to why it's important to be screened. I do agree with Dr. Powers that at a certain age or at a time of frailty, that colonoscopies and mammograms are not going to be beneficial due to a remaining lifespan that might be short. However, wherever you are in life, you can make a difference in your destiny. So let's look at what happens to us as we age. As we get older, we do know that we have a lower ability to have maximum oxygen consumption. And if we smoke, that capacity is even lower. As we get older, our blood pressure rises. That's because our vessels become more stiffer. So that top number, the systolic number, will rise. For example, if your blood pressure when you were younger was 120/80, you may very well anticipate that by the time that you're in your 70s, your blood pressure might be 150/80. Other aging findings that we may see is a lower bone mass. So as we get older, the density of our bones will lose mass, and so it will actually kind of thin. When that happens, that is what we call osteoporosis. Osteoporosis makes our bones fragile and they might fracture, and this will cause reduced height. So you may have recognized people that you've passed by who have a very humped over posture. More than likely, that's related to osteoporosis and fractures of the upper back. Also, something that we may very well anticipate, we talk about weight, but at the age of 74, we may actually see our weight become lower. Now, although we do encourage people to lose weight, that is an individual choice depending on your chronic illnesses and and where you are in life. For example, if you are overweight, we may recommend that you lose weight because of your needs, knee pain. However, we do know that there is a weight that we do become concerned about, because if you're underweight, then we know that will increase the risk for morbidity. So in other words, that your health would actually be lost. Also, as we get older, we lose lower kidney function. So this is happening every year, even at the age of 20. So we need to be very careful regarding what we take over the counter, for example. So for arthritis, we need to be very intentional regarding anti-inflammatories such as ibuprofen or naproxen. If that is to be utilized and you have very good kidney function at the current time, then you want to stay as low of a dose as possible. And we do know that sustained release anti-inflammatories can be a little harder on the kidney. So be mindful of that. And next slide, please. There is significant importance of sleep, as Jim had mentioned earlier, as well as the physical activity and exercise for cardiac and brain health. Now, as I said, you yourself can make a difference in your destiny by being intentional regarding your sleep hygiene, such as ensuring that you do have a restful sleep. As we age, we appear to not need as much sleep as we did when we were younger. However, if you're only sleeping 5 hours a night instead of that 7 to 8 hours that's recommended, and you feel restful when you get up, you shouldn't worry about that. And you shouldn't fret because if 5 hours is working for you, that's apparently all you need. And certainly fretting and worrying will make your quality of life worse. If you got a good sleep with 5 hours, then you got a good sleep, period. Now, if you're not sleeping well, I did mention about being intentional regarding your sleep hygiene. So let's look at your bedtime routine. Are you drinking caffeine after noontime? Some effects of caffeine may occur later. We often think, well, I'm not going to drink coffee at night, but perhaps that noontime coffee is having its effect. Also, keep in mind that tea and soft drinks have caffeine. One thing that we don't often think of is to be aware of chocolate, because chocolate has caffeine. The darker the chocolate, the higher the caffeine content. So some dark chocolate bars, for example, have as much caffeine as a can of Coke. Were you aware of that? Do you watch TV in your bedroom, or are you on your smartphone or computer in your bedroom? It's often said by many clinicians, including myself, for good sleep hygiene, the bedroom should only be used for sleep and sex. Physical activity such as walking is an exercise that's always better than sitting around all day, as it does affect your heart and your brain health rather than being sedentary. So what can you do to make a difference in your destiny? You've heard, and you will probably hear it again. Do not be isolated. Keep a healthy social circle. Stay away from negative thinking people. Have you ever found yourself around people that just blah? Everything they say is negative? Find you some new friends. Be around people who are uplifting and engaged in living. Be mindful of the world around you. Look at the stars in the sky, the trees around us. knowing that there's something bigger than ourselves out there. Focus on your sense of purpose. How can I live the rest of my days in the best way possible? Try your best to eat well. I know at times it's quite challenging, and for some people it is very challenging. But just taking note of when you have a piece of bread, what is the best choice? White bread, or as I was growing up here in the South, we called it light bread. Or is it a choice of wheat or multigrain bread? If you're able to choose the wheat or the multigrain, it's very healthy for you. And it also, as we get older, it helps us with our bowel movements. Eating a handful of nuts daily is healthy, such as almonds, which are the healthy choice among the different types of nuts that we can choose from. And a plant-based diet is better than eating a daily meal of red meat. You heard Dr. Powers talk about alcohol. We and some can drink alcohol in moderation, as again, it's not recommended, to pick that up. But if you're already drinking, keep in mind as we get older that our metabolism does change. So if a glass of wine impairs you now, then this should be avoided. Keeping in mind that drinking a glass of wine without having eaten anything all day will cause rapid absorption and will affect your brain. And of course, smoking has no health effects, no health benefits at all. And it increases the risk of lung disease and heart disease and narrowing of the vessels, which can result in amputation of the toes, the feet, and even the legs. Also have stroke from smoking, and cancer of the mouth or within the neck, the lungs, and even including the bladder. So what do we need to do? You need to see your healthcare provider and always get your weight taken. Have a weight assessment. Find out, are you overweight? Are you obese? Are you underweight? Ask about breast cancer screening and colon cancer screening. Knowing that if there is a cancer that's there, you want it caught early. The earlier, the better is the cure. Everyone should be screened for diabetes, as well as glaucoma. And this should be done by an eye specialist as far as the glaucoma. If you do have diabetes, be sure to have an eye specialist perform your eye exam to get a great look at the back of your eyes, because early findings can be found by the eye specialist. And what about those high-risk medications? You heard Dr. Powers talking about our metabolism. Hey, that Benadryl that we took when we were much younger was an excellent drug and very effective for those allergies that we were talking about. But as we get older, the Benadryl, our bodies are much more sensitive to. And so it actually increases our risk for impairment of our memory, as well as confusion and even falls. Also, the medications that we took when we were younger and still taking now can have drug interactions. So can have interactions with other medications that we're taking that perhaps had no effect when we were younger. So you need to have your healthcare provider look at your medications very closely and tease them out for possible risk of actually doing harm. And as you all know, we should take our flu shots every year. Take the pneumonia shot if you're age 60 or older. The pneumonia shot is also known as the pneumococcal vaccine. And nowadays, we have to worry about that COVID shot. So please, if you have not already, please consider taking the COVID shot as well as the boosters, because we know that these things will prevent serious illness and hospitalization and even death. Next slide, please. As you heard from Dr. Powers, life expectancy is influenced by our behavior. I would like to just stop here briefly and talk about African American culture. Something that's quite common is the fact that we may not exercise because we worry about our hair. In fact, 28 to 45% of us feel that our hair impeded maintaining a healthy body weight. Simply because we did not want the sweat or exercising to mess up our hair cells. Now, this is pretty serious business. When I look at my own family and my destiny, the majority of my family are overweight and most are obese. Many of them have diabetes. And those who have passed away have died from a major stroke. So I ask, at least I ask myself, do I want to be a healthy ager, or do I want my hair looking good when I die in the casket? So these are things that we need to think about regarding our destiny. I now would like to talk about some tips and pearls. What I like to encourage folks to do is make exercise as part of your routine. For example, make exercise a game. I'm a morning person, and so I exercise in the morning. I'm refreshed when I work with my exercise because I'm thinking about my day and I'm meditating. You also consider using smart watches, for example, to keep count of the number of steps that you take. Now you can, again, make this a game by competing with yourself, saying how many steps I'm going to do today compared to yesterday, setting a goal, or compete with other friends of yours or family. And oftentimes I do that with my own grown children. We like to do a variety of exercises and we make it a game. And that keeps us motivated. Now, going back to our hair, everyone is different, black and white. Learn what your hair likes or dislike and how you can make it flourish. There's no right or wrong way to explore your hair. Moisturize your hair, but avoid the mineral oil or formulations with alcohol. You can even use a little bit of water in moderation to just simply hydrate the ends and wrap the hair so that when it dries, that the ends are straight or flat and not frizzy. Keep the hair off the neck. You can do specific updos to keep the curls intact, or even do an afro puff. Brush the hair and put it back in a ponytail, or put it in cornrows or twists or locks or plaits, and wrap a bun on top of your head. And that's one of the things I like to do. Feel very comfortable embracing accessories such as headbands. I like to wear a headband. It keeps my hairline fresh, but don't cover the entire head because that will create heat and mess up your do. Next page. So in summary, what I would like to say, from what you've heard from Dr. Powers and myself, it's very important to maintain a healthy social network. Stimulate your brain. Participate in physical activity. You are what you eat. Share with your healthcare provider regarding your goals and wishes. Don't let your visit go by useless. Ask questions. If you don't understand, ask questions. Squelch your stress. If you pray, pray. Be mindful and meditate. Take your time. Live your life. Learn what you want to do and make life worth living. Thank you.
Thank you so much, Dr. Powers and Dr. McClure. That was awesome information, and I'm looking forward to kind of building on what you guys have already said. Thanks for the opportunity to be here today, Grace and AgeWell. You can go ahead and move on to the next slide, please. So as we've already talked a lot about today, aging increases our risk for a lot of things, such as health issues, high blood pressure, heart disease, diabetes, that kind of thing. Additionally, reduced cognitive function. Our brains don't work quite the way that they did when we were younger. Of course, falling is always a challenge, and those injuries as we fall as well. And then this has also been mentioned, but joint pain and inflammation, that also increases as we age. And we know that our weight plays an important role in these things. So these are already happening as we age, and obesity only increases the risk of these happening faster. So it's important to keep our weight in check to ensure that we can slow these processes as much as possible in the aging process. I did a lot of research before this presentation, and I wanted to understand more about why obesity really increases or accelerates the aging process. And so much of what I read was that it just really accelerates the process of aging by creating those metabolic imbalances and decreasing our lifespan due to the impact that has on different cellular and molecular processes in our bodies. So it almost simulates the aging process. Some examples of what happens are damage to our DNA due to free radicals that are in our bodies, damage to cells that create inflammation and insulin resistance, which can lead to diabetes. Our immune system stops working quite as well as it did when we were younger. And then it just, with the aging that takes place in our liver, it can accelerate your age by 2.7 years for every 10-point increase in your BMI. So there's overwhelming evidence that shows that carrying excess weight can accelerate the aging process. So on the next slide, I'm going to talk a little bit more about some of those lifestyle habits that have already been talked about quite a bit today to help understand what we need to do to slow this aging process. So as mentioned, incorporating more physical activity or exercise into your routine. 150 minutes is what the CDC recommends for a healthy amount of exercise each week. That can be broken up into 10-minute bouts of exercise per day, but 30 minutes per day for 5 days a week is sort of the recommendation. Of course, eating a healthy and balanced diet that is sustainable long-term. And I wanted to include that last part about being sustainable, because a lot of times we try to make so many changes all at one time that you can do it for maybe 2 or 3 weeks, and then you're like, man, this is too hard, and then you revert back. So making choices that you can choose to do for a long time is super important. Of course, drinking 8 ounces or 8 cups of water per day, so about 64 ounces. It can vary based on your body size and your body weight and how active you are in things, but water is the most essential nutrient out there. We could go days without food, but we could not go days without water and survive. So drinking plenty of water is vital for healthy skin, healthy cells, all of that good stuff. As mentioned a lot already, also getting plenty of sleep every night. So on average, adults should get 7 to 8 hours, but as Dr. McClure said, you have to know your body, and you have to know what really fuels your body for a good rest and to power through your days. And if you feel good after less sleep than 7 to 8 hours, that's perfectly fine. But on average, around 7 hours is what most adults should get. Practicing stress management techniques and mindfulness. We live in a hustle bustle culture, and we're always on the go. We're always moving quickly from one thing to the next, and it's hard to slow down and take quiet time and just to sit and to take some deep breaths and focus on your breathing and really just think about what matters. We get so caught up in all the details and running here and there that we forget that, like, we have breath, which is so simple, and focusing on that can help with stress management. But there's plenty of other stress management techniques out there for you to explore and find something that works for you. Of course, limiting alcohol consumption has already been mentioned. Of course, it has empty calories in it, and it also impairs your decision making. So you might choose foods that are less healthy. You might not feel like going to the gym to be active, and so it doesn't help you to make the best decisions. I wanted to go back to sleep. Actually, I forgot to mention this, but I learned this in my work at the Y. In our weight loss program, there's actually 2 hormones that are really pivotal that when you don't get enough sleep, they affect your decision making when it comes to food. So one is called leptin, and leptin is the hormone that tells your body when to stop eating. So when we're sleep deprived, our body actually decreases this amount of hormone that's produced in our body. So when we don't get enough sleep, our body does not inform us, hey, stop eating. And then the other hormone is ghrelin, and this tells your body when to eat. And so when you're sleep deprived, this hormone increases. And so you have a hormone that's telling your body to keep eating, and then less of the one that tells you to stop eating. So just from a scientific standpoint, I thought that was super interesting to understand why sleep is so important. I think we hear it all the time. Sleep is important for weight loss, but why? And when I talk with my participants in our program, they're like, oh, wow, I never knew that. And I just think that it's helpful for people to understand why is something helpful for me in order to be motivated to do it. So I wanted to make sure to tell you guys about that. You can move on to the next slide. So in my work at the Y, I've learned a lot about why people have good intentions at losing weight, but why do they often fail? Why do we often fail at this? So the first thing that I've noticed is that we don't understand the true value of weight loss. What's in it for me? What do I have to gain or benefit from losing weight? I feel fine how I am, like what's in it for me? So understanding the value is the first one. The second one, which is huge, I see this all the time, is this all or nothing mentality, or this approach. I've got to change all of it or I'm not changing any of it. And that's unrealistic. So, we think a lot in life, there's a lot of gray areas. We don't think of a lot of things in black and white terms. But for some reason, I see so many people approach weight loss with this black or white thinking of, I've got to be all in or all out, and there's no gray area. So finding that gray area is going to be key. Kind of along the lines of what I just said, is setting those unrealistic goals and trying to change too much too fast. So I mentioned sustainability earlier when we were talking about a diet that's healthy and balanced and sustainable for the long run. And that is very important when it comes to goals. You've got to set goals that set you up for success and don't overwhelm you with, oh my gosh, I have to change all the things right now. It's overwhelming and not something that you can do for a long time. Also, there's a lot of this diet mentality. I've got to do the paleo diet, or I've got to do the Whole30, or I've got to do this, or I've got to do that. And so when you have this diet mentality, typically there's a start and an end to a diet. And so when you're thinking of that, you're not thinking of like a lifestyle pattern. You're just thinking of, how can I do it for this period of time? But then usually when you end your diet, you go back to the way it was before. So then what's the point? So it's less about having that diet mentality and more about, how can I make lifestyle changes that benefit me in the long run that I can continue to do for a long time. Another pitfall is becoming obsessed with the number on the scale, which I know is difficult to avoid when you're told, hey, it'd be helpful to lose some weight. It's hard not to think, all right, I better get on the scale and look at the numbers. And if it's not changing, then I'm failing. But I think there's other ways that are more meaningful and more telling about losing weight and our health, which is, how do your clothes fit? Or how do I feel? Do I have more energy? Am I sleeping better? Am I thinking more clearly? There's other indicators that I think are more powerful than the number on the scale. The number on the scale will come down if you make those choices. And I think sometimes obsessing over it causes more stress, which causes havoc in your body hormonally and just does not help your cause. Being unaware of your own self-defeating thoughts and mindset. I think there's an activity we do in the weight loss program that we ask participants to think of a recent thought that they had about themselves and imagine saying it to someone that they love. And some people have cried thinking about that because they're like, I would never say that to someone else. So being unaware of those and how they sabotage your choices is a big one as well. Sometimes our home and work environments don't promote healthy choices. So we might have bowls of candy laying around that are out in the open that are really easily accessible, or we might have, we work at home and so we don't have to get out and move around very much. So there's a lot that goes into your work and home environment that impacts your choices. And then lastly, no planning or accountability. So not planning ahead and doing everything on the fly does not help, and not having anybody to hold you accountable. Next slide, please. So some tips for getting started. Define your why. What is it that motivates you? What's your reason for choosing to focus on your health? This is going to be vital for your long-term commitment. And it needs to be internal. There's a lot of external motivators like, oh, I have an event coming up, I want to look good for it. But what happens when that event's over? So you've got to look deep within inside you and find out, what is it? Maybe it's you want to be healthy for your kids. Maybe it's you want to be able to care for your parents as they're aging. Whatever that is for you, find your why. And then start small. So I like to think of the Dave Ramsey snowball method for paying off debt. It's the same as true as for weight loss. You can apply that same concept. Start small, reward yourself for those small victories. And as you accumulate more and more victories, you're going to have more motivation and more traction for those larger goals. And along those same lines, think about SMART goals. It's a different way of writing goals, but it's much more impactful and helpful. So SMART goals are specific, measurable, appropriate, meaning they're related to your long-term goal. They're realistic, meaning that, let's say you never exercise and you're going to set a goal to work out 6 times per week. That's not realistic. So you want to start with maybe 1 or 2 days per week. And then it's time bound. So you have to set a time frame so that you can say, within this amount of time, I accomplished this goal. Track your food and activity as well as your associated feelings. So research does show that that tracking your food helps people lose weight and keep that weight off because you're just more aware of what you're eating. And then the feelings part of it helps you to understand what your relationship with food is. So if you are eating out of boredom or out of sadness or out of joy or out of just whatever emotion you may be feeling, you're going to start to understand why you make the food choices that you do. And the same goes for exercise. I also think with exercise, we think a lot of it as exercise, but I like to phrase it in the term of physical activity or lifestyle activity, because exercise sounds like a chore and is actually a subcategory of physical activity. Physical activity can be doing yard work, walking your dog, parking further away from wherever it is you're going, taking the stairs instead of the escalator. This is all physical activity and lifestyle activity, which is more encompassing. Exercise feels a little bit more daunting. So I reframe how you think about moving your body, because that's what it's all about. And when it comes to food, remember that all foods fit. No foods are off limits. Foods are not good or bad. They're just food. You just have to choose them in moderation and choose ones that are going to fuel your body for health. And then, like I said earlier, just focus on how you feel and how your clothes fit instead of worrying about the scale. Next slide, please. We already talked about this a little bit earlier, but paying close attention to how you talk to yourself. And when you catch yourself talking bad about yourself or to yourself, reframe those thoughts into something positive. Find a way to say what you said in a negative way in a positive way. I recommend taking an audit of your home and work environment. What in your environment is causing you to stumble? What's causing you to reach for that bag of chips when you should maybe grab some fruit? How can you replace things in plain sight that are going to help make the healthy choice the easy choice, is what I like to say. Make a plan for each week and start to get into a routine, whether that's going to the gym, going to bed earlier, meal planning, meal prepping, going to the grocery store. Just get on top of the planning, because planning makes all the difference in the world. And then find somebody to hold you accountable. That's key, because it's easy to not show up for yourself, but when you have someone that's counting on you, it's much easier to stay in the routine. And then lastly, apply the 80-20 rule. So 80% of the time you are focusing on your health goals, and 20% of the time you're living in the moment and just enjoying yourself. So if you apply that 80-20 rule to your life, I think you'll find that that's where you find a good balance of enjoying your life, but also taking care of your health. And just a couple of resources for you guys. I won't spend too much time here, but we do have a weight loss program at the Y if you would like some help. We also have virtual nutrition counseling, personal training, and then one of my favorite healthy meal delivery services is AgeWell Nashville. And then there's just some tools. I think if this is not available for you, I'll talk to Grace about how we can share these resources. So thank you.
Thank you, Elizabeth, and Dr. Powers and Dr. McClure. Audrey, we are ready for you.
Well, thank you for the invite. I have agreed with all of the speakers in terms of what they said, and I try to carry out that, to live long and healthy and aging well. A few things I might want to say again. As an infection control nurse, retired from the VA Medical Center, that's how I met Dr. Powers, is that we have been pretty much locked down with the COVID, but I encourage everybody to continue. I would say, as I was working, wash your hands, but now we have more concerns and worrying about our exposure to the COVID virus. So if you can, I would suggest and encourage you to get the vaccine. But in addition to washing your hands, wearing your mask, and my daughter was here visiting with me, and she just said, you know, you talked about washing your hands, but you got to tell everybody now, wear your mask, wear your mask. We want to protect ourselves and we want to protect others. So in listening to you all, I kind of changed my topic a little bit, but I do agree about the nutrition is so important, the exercise. And as I get older, I definitely want to ditto socialization is so important. It is so, because being alone and being for those who are living by themselves, not having anybody around, you need somebody to talk to, you need to get out, visit your neighbors. Two things you can do, as we talked about: exercise, walking in the neighborhood, waving hello to your neighbors. And we want to stay connected to see if we all are all right. Because we don't do too well without socialization and being closed in. So that is really necessary. And if you haven't gotten, the vaccines, I would really strongly consider that. But one thing I want to add to that, brain health. I attempt to do the Sudoku, at least a little something to keep my mind stimulated. So are there any questions about anything? I didn't want to, be redundant in terms of the other eating well and resting and sleeping. I do have one quick question, and maybe Dr. Powers, is that as I age, I don't sleep as well. That is something about aging and this sleeping.
That is true. You don't need as much sleep. However, the most important sleep is the part that occurs early on. So going to bed a little bit earlier, like 9 o'clock instead of 10 o'clock, will give you those slow wave sleep patterns that are so important in preserving brain health. But it turns out that older individuals, you can't sleep a long time, like 8, 9, 10 hours. It just doesn't work. But you do fall more efficiently into the slow wave sleep again early on when you first go to sleep. So the recommendation is to try to achieve 7 hours and to go to bed a little earlier so that your brain benefits from the slow wave phase of sleep.
One thing about, and it sometimes affects me, is that when we don't get the number of hours of sleep at night, we nap during the day. and that affects our nighttime sleeping.
Yes, avoid that. Sleep should be in the evening. If you do nap during the day, it should be short, but realize that you'll pay a price by less sleep at night.
Well, thank you, Dr. Powers. I just thank you, Grace, for inviting me to speak on my topics.
Thank you, Audrey. And now we're going to take a question. I saw one question submitted, and this gets back to the sleep question. This individual has a Fitbit that measures sleep, and the Fitbit is showing that she gets anywhere from 18 to 90 minutes of deep sleep per night, but she's trying to figure out, she can't see associations between what she does during the day and making more deep sleep. Any other suggestions besides going to bed an hour earlier for ensuring that you get that deep sleep?
That is the recommendation by our neurology colleagues who study sleep patterns. You cannot create more deep sleep patterns, but when you first fall asleep as an older individual, you go almost immediately into the slow wave deep sleep pattern, which is the most helpful for brain health.
Dr. Powers and Dr. McClure, any benefits to melatonin if it's difficult to fall to sleep or you're trying to get more deep sleep? Anything to watch out for with melatonin?
Stephanie, would you like to take that?
Yes, I know recently there's been talk in the news regarding melatonin, and what I have found, particularly I have prescribed it in after folks have had knee surgery or hip surgery in the rehabilitation hospital, and melatonin was very helpful. However, other people have had different experiences with melatonin, and perhaps Dr. Powers could share his experiences, but in post-surgery rehabilitation hospitals, that seems to be effective.
Right, melatonin is a natural product and has a much better safety profile than many other sleep aids, and it is one of the first things that we try. It has been effective for travelers, we know, taking it in a new time zone when you try to go to sleep at your usual time is what is recommended. But again, it's a natural product. It's better to not use any sleep aids if possible, but among the sleep aids that are available, I have found it effective in general safe. And you can take a very small amount, 1 milligram up to about 12 milligrams, and it's over the counter.
Thank you both. And I think Dr. McClure, thank you for sharing those thoughts too about sleep hygiene. I find if I look at my phone right before I go to bed, or I'm looking at any screen, it makes it very hard for my brain to slow down and fall asleep. So I think paying attention to what we're doing in the 30 minutes to an hour before we go to bed also makes a difference. Well, we are near the end of our time. And again, I just want to thank all of our panelists today. Thank you so much for sharing your expertise and your perspectives with us. I know I'm walking away with a lot of useful tips, and I hope that everyone joining us today is as well. We want to invite you to continue to register for our additional webinars in this series. Our next one will be in July with a focus on nutrition, and we will be publicizing that date, and you will need to register for each webinar because they will have a unique Zoom link. So please stay tuned. You can visit the agewelltn.org website and look under our events tab to see a schedule of upcoming webinars. I want to thank again, next slide, our series sponsor, GNRC, Area Agency on Aging, and our partners at Jewish Family Service and the YMCA of Middle Tennessee. Next slide. We hope that you will reach out and you will take a look at our website at AgeWell. We are now located on the campus of Second Presbyterian Church on Belmont Boulevard. We welcome you to stop by, pick up a copy of our directory of services or any of our resource guides. And again, please visit our website. Thank you for joining us today. Thank you for listening, and I hope that you are leaving today's webinar with many tips that you can begin to incorporate into your lifestyle to live and age well. Take care.